This is Azar again, Dr. Physical Therapy. Today I want to go for the next deformity of the hip. Ready for hearing the next one? So the next deformity of the hip is not as bad as congenital dislocation of the hip, of course, CDH, and is not too cruciate, but is later on is going to cause problems. So we better to fix it as soon as we see it. That problem is called anteversion of femur. We actually have anteversion and retroversion of femur both, but anteversion is very, very more common, and I'm going to show you how we can figure that out. So first thing we want to know is in the kids that maybe like 3-4 years old, sometimes they get so excited and they say, oh mommy, I can sit like this, and none of my friends in the kindergarten or preschool, they can sit like me, and they are proud of themselves. They're so happy, they're having fun with what they can do. And then you probably proud of them too. You said, oh, my kid's so flexible, they can sit like that. And then, but you started looking at it and then see, they cannot sit crisscross. It doesn't look like they're comfortable sitting crisscross though. That's weird. And then you just think, oh, that's my kid's preference. But it's not. Most of the time they have hard time getting in the crisscross position. Why? Because that femur bone, again, our friend that goes to that fossa, remember that femur bone goes to the acetabulum fossa? That femur bone is not in the right place. So, and then how we can make sure that we know that? The kid's gonna walk later on with the into, right? A lot of time you can see your kids like walking with the into. You said, why? Why is she in toes? Usually it's a she, but sometimes it can be a he too. And then you think that's because of the foot. You take the kid to the foot doctor, and the foot doctor checked them and said, no, the foot's fine. And you said, okay, that's the preference then. That's okay. So it's going to get better later. Again, no, be careful. If you see the W sit, this guy, along with that one, along with this, okay, into walking together, that's a red flag. So you want to make sure that you take the kid to the doctor for an x-ray of the hip, because most likely they have femur anteversion. It's not life-threatening. It's not like not going to cause the leg discrepancy like this congenital dislocation of hip. It's not going to be like that bad, but later on it can cause earlier arthritis of the hip and all kind of problems, and even weakness of the core, and make the kid prone to the back problem later in life. So it's very crucial for you to figure that out in early age and help your kid to get the best of what she or he can to be able to not have that much problems later, right? So this is showing you, it's a little complicated, I'm not sure if you can follow me on that, but that's showing the difference between the angle of how the femur goes inside the acetabulum. That's about the angle problem. The acetabulum depth is not a problem like the CDH, the depth's fine, and it's just sitting on the acetabulum, the femur bone sitting on the acetabulum in a little bit of a wrong angle. But that can cause like your kid to really have a hard time with the crisscross. You like want them to do crisscross because that's the best, right? And they have hard time, they hurt right here, right? And that's a problem. So now you're gonna really know that, oh, my kid has an issue because they can't sit crisscross like the others. What you wanna do, you wanna encourage them to crisscross as much as possible, but not always that's the answer, because if it hurts, really hurts, then they probably don't do it. They probably just do it in front of you, and then later on they're gonna go back and do like this. They're gonna back and sit like that, their favorite position, and then you wanna keep having fight with them. But take them to the doctor, have them just diagnose them properly, and then don't push them to walk outside with the outfit, because when they're in-toed is not a problem, usually not from the foot. Sometimes it could be from the foot though, don't take it wrong. That's why you have to take the kid to the doctor, orthopedist. But it's not always the podiatrist's job, it's not always the foot, so most likely it's the hip. So then if the hip got diagnosed with that problem, then great. Then you can make sure at least where to start. And then usually it's a physical therapy. If it's really severe, they might want to do surgery on that. This one's not like a CDH, they're not going to do surgery on this one. And they probably just strengthen the glutes and leave it alone, and then have the, encourage that stretching, and then making sure that patients can really like do a lot of exercises and physical therapy. and they go from there. So it's very, very important for you to catch it early and then go for the treatment. Sometimes it could be not anteversion, retroversion. That usually happens in the boys. And retroversion is what? They, instead of going in, walking into, they walk out to a lot. A little bit of out-toeing is actually fine. A lot of people have that. But too much out-toeing, usually coming from the hips. It's the hips too much angle out this time. So they have problem, like they can't even do that much of the internal rotation. They probably shouldn't do that anyways, but they can't even do that much. But they can do a lot of good opening, hip opening. So that's usually for the boys. And that's also causing problems, but not as much as the retroversion. Is not not as much as the anteversion, and it's not as common as anteversion. So now you got familiar today with anteversion and retroversion of femur as the two hip deformities that can cause the kid to walk with the different way, like the foot inside or outside, so into and out to, and the sit in a different way. Not being able to do the crisscross and do W sit, and not being able to do any kind of internal rotation of the hip, and they can have a lot of motion in the crisscross. Basically, that's the two opposite one. Thank you for watching. Hopefully that helps you, and later on we're gonna cover how we can fix these deformities with physical therapy. Have a great day. Bye-bye.